Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about fetal engagement. So go ahead, subscribe, and let's get started. Today we are going to learn about fetal engagement, an important topic in obstetrics. Engagement is the process by which the presenting part of the fetal, usually the head, enters the maternal pelvic inlet, indicating that the baby is preparing for labor. In prima gravida, engagement usually occurs before labor, while in multigravida, it often occurs during labor. Understanding fetal engagement helps nurses assess the progress of pregnancy and labor. Now let us learn about fetal engagement in detail. Fetal engagement is the passage of the widest transverse diameter of the fetal head, called the biparietal diameter, through the maternal pelvic inlet. In simple words, engagement means the baby's head has entered the mother's pelvis and is ready for labor. The biparietal diameter measures about 9.5 centimeters. When this diameter passes through the pelvic brim, the fetal head is said to be engaged. Now, let's look at the important diameters of the fetal head. Don't worry, there are only 3 you need to remember. First is the biparietal diameter, or BPD. It measures 9.5 centimeters and is the most important diameter because it is the one that passes through the pelvic inlet during engagement. Next is the occipitofrontal diameter. It measures 11.5 centimeters and is the largest front-to-back diameter of the fetal head. Finally, we have the suboccipitobregmatic diameter. It also measures 9.5 centimeters. This is the diameter that presents during a normal, well-flexed vertex delivery. A simple trick to remember is this: 9.5, 11.5, and 9.5. Both the biparietal diameter and the suboccipitobregmatic diameter are 9.5 centimeters, while the occipitofrontal diameter is 11.5 centimeters. Keeping these 3 measurements in mind will make it much easier to understand fetal engagement and the mechanism of labor. Now let's understand the maternal pelvis and its role in fetal engagement. Engagement takes place at the pelvic inlet, which is the entrance to the birth canal. It is formed by the sacral promontory at the back, the linea terminalis on both sides, and the upper border of the symphysis pubis in the front. An important point to remember is that the anteroposterior diameter of the pelvic inlet is about 11 centimeters. This allows the baby's head to pass through the pelvis after normal flexion and molding during labor. A simple way to remember this is that engagement occurs at the pelvic inlet, and the pelvic inlet has an anteroposterior diameter of about 11 centimeters. Now, let's see when engagement usually occurs. In a first pregnancy, also called a prima gravida, engagement usually takes place between 36 and 38 weeks of pregnancy. By this time, the baby's head becomes fixed in the mother's pelvis before labor begins. In women who have had previous pregnancies, called multiparous women, engagement often occurs during labor. This is because the abdominal and uterine muscles are more relaxed, allowing the baby's head to descend later. A simple way to remember this is, in a first pregnancy, engagement usually happens before labor, while in women with previous pregnancies, it commonly happens during labor. Now, let's understand the mechanism of engagement. Engagement does not happen by chance. Several factors work together to help the baby's head enter the mother's pelvis. First, the baby's head should be well flexed, so the smallest diameter presents first. Good uterine tone and stronger contractions near the end of pregnancy help push the baby's head downward. The shape and size of the mother's pelvis should also be adequate to allow the head to pass. At the same time, the size of the baby's head should be suitable for the pelvis. Finally, gravity also helps the baby's head descend, especially when the mother is standing or walking. A simple way to remember this is that engagement depends on 5 things: a well-flexed fetal head, effective uterine action, an adequate pelvis, an appropriate fetal head size, and gravity. These factors together help the baby's head engage before or during labor. Now let's look at the signs and symptoms of engagement in the mother. One of the first signs is called lightening. This means the baby's head has moved down into the pelvis. As a result, the abdomen looks lower, the fundal height decreases, and many mothers say, "It feels like my baby has dropped." Another common change is easier breathing. Since the baby has moved downward, there is less pressure on the diaphragm. This gives the lungs more space to expand, so the mother feels more comfortable and shortness of breath is relieved. A simple way to remember this is, after engagement, the abdomen drops lower and breathing becomes easier. These are two of the most common maternal signs of engagement. Now, let's look at some other signs that a baby has engaged. As the baby's head moves deeper into the pelvis, the mother may feel increased pressure or heaviness in the pelvic area. This can also cause pelvic discomfort. Because the baby's head presses on the urinary bladder, the mother may need to pass urine more frequently. This is a very common complaint near the end of pregnancy. Some women may also find walking a little difficult because of the increased pressure on the pelvic floor. Low backache is another common symptom due to pressure on the pelvic joints. You may also notice an increase in vaginal discharge because the baby's head puts more pressure on the cervix. A simple way to remember these signs is that once the baby engages, the mother experiences more pressure below than above. So she may have pelvic heaviness, frequent urination, difficulty walking, backache, and increased vaginal discharge. Now, let's learn how to assess engagement during an abdominal examination. One of the most common methods is the fifth Leopold's maneuver, also known as Pollock's grip. In this method, we check how much of the baby's head can still be felt above the pelvic brim. If most of the head can be felt above the pelvis, it means the head is not yet engaged. As the baby descends, less of the head can be felt. When only a small part of the head is palpable, or it cannot be felt above the pelvic brim, the head is considered engaged. A simple way to remember this is, the less fetal head you can feel above the pelvis, the more engaged the baby's head is. Now, let's understand the rule of fifths, which is a simple way to assess fetal head engagement during abdominal examination. The rule tells us how much of the baby's head can still be felt above the pelvic brim. If the head is 5 by 5 or 4 by 5 palpable, the head is not engaged. If it is 3 by 5 palpable, the head is partially engaged. When only 2 by 5 of the head is felt above the pelvis, the head is considered engaged. If only 1 by 5 is palpable, the head is deeply engaged. When no part of the head can be felt above the pelvis, or 0 by 5 is palpable, the head is completely engaged. A simple way to remember this is, as the number becomes smaller, the baby's head moves deeper into the pelvis. So 5 by 5 means not engaged, while 0 by 5 means completely engaged. Now, let's learn about the rule of station, which tells us how far the baby's head has descended into the birth canal. It is measured in relation to the ischial spines of the mother's pelvis, which serve as the reference point. When the baby's head is above the ischial spines, the station is given a negative number. A station of -5 means the head is floating high in the pelvis. -3 means the head is above the pelvic inlet. -2 indicates the head is descending, and -1 means the head is almost engaged. Station 0 is very important, because it means the widest part of the fetal head has reached the level of the ischial spines. This indicates that the head is fully engaged. As the baby moves further down the birth canal, the station becomes positive. Stations from +1 to +5 show progressive descent of the fetal head, with +5 indicating that the baby is at the perineum and ready for birth. A simple way to remember this is, negative stations mean the head is above the pelvis, 0 station means engagement, and positive stations mean the baby is moving down through the birth canal. During a vaginal examination, engagement is confirmed by assessing the station of the fetal head. The ischial spines are used as the reference point. When the presenting part is at the level of the ischial spines, it is called station 0. This means the widest part of the fetal head has entered the pelvic inlet, and the head is fully engaged. In simple words, remember this: station 0 equals engagement. This is one of the most reliable clinical signs that the baby's head has entered the mother's pelvis and is ready to continue descending during labor. Several maternal and fetal factors can influence whether the baby's head engages properly. On the maternal side, the shape and size of the pelvis are very important. A small or abnormal pelvis can delay engagement. Pelvic tumors may block the baby's descent. A full urinary bladder or a full rectum can also temporarily prevent the fetal head from entering the pelvis. On the fetal side, a large baby, also called macrosomia, may have difficulty engaging. Conditions like hydrocephalus increase the size of the fetal head and can delay engagement. Abnormal presentation such as breech or transverse lie, abnormal positions like occiput posterior, and a deflexed fetal head can also interfere with normal engagement. To remember this easily, think of two groups of factors: maternal factors, which involve the mother's pelvis and pelvic organs, and fetal factors, which involve the baby's size, head, position, and presentation. Together, these determine whether engagement occurs normally. Some conditions can delay or prevent the baby's head from engaging in the mother's pelvis. One of the most common causes is cephalopelvic disproportion, or CPD, where the baby's head is too large for the mother's pelvis. A contracted or small pelvis can also make engagement difficult. Placenta previa may block the baby's descent, while pelvic tumors can physically obstruct the birth canal. Certain fetal presentations such as breech, face, or brow presentation are also associated with delayed engagement because the head is not in the ideal position. An occipito-posterior position can make the head descend more slowly. Conditions like hydrocephalus, where the baby's head is enlarged, and macrosomia, meaning a large baby, can also delay engagement. Polyhydramnios, or excessive amniotic fluid, may prevent the baby's head from settling into the pelvis before labor. A simple way to remember this is that delayed engagement usually occurs because of problems with the pelvis, the baby's size, the baby's position or presentation, or anything that blocks the birth canal. Engagement is an important milestone in pregnancy because it shows that the baby's head has entered the mother's pelvis and the body is preparing for labor. When the head is engaged, it suggests that the mother's pelvis is adequate for the baby's passage, making a normal vaginal birth more likely. As the baby moves down, the pressure on the diaphragm decreases, so the mother often feels that breathing becomes easier. Engagement also indicates that labor may begin in the coming weeks, especially in first-time mothers. In simple terms, engagement is a reassuring sign that the baby is in the correct position and that labor is likely to progress normally. Now, let's look at the fetal significance of engagement. When the baby's head is engaged, it acts like a plug at the pelvic inlet and helps prevent the umbilical cord from slipping down before the baby. This reduces the risk of cord prolapse, which is an obstetric emergency. Engagement also helps labor progress more effectively because the fetal head is well positioned to descend through the birth canal during contractions. It indicates that the baby is in a favorable position for a normal vaginal delivery and reduces the chances of malpresentation during labor. In simple terms, engagement protects the baby, supports smooth labor, and is a good sign that the baby is in the right position for birth. That's the end of this video. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.